Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. So நம்ம MCQ series வந்து பார்த்துட்டு இருக்கோம். வரக்கூடிய JIPMER and NORCET examsக்காக. So magic pills ஒவ்வொரு கொஸ்டின்ஸுமே வந்து ப்ராப்பரா சால்வ் பண்ணி அதுக்கான ரேஷனல் ஒவ்வொரு ஆப்ஷனோட ரேஷனல் அப்படின்னு சொல்லிட்டு ஒரு நேம் சேக் இல்லாம கரெக்டா எந்த கொஸ்டினை எப்படி ஷூட் பண்ணணும் அப்படின்னு சொல்லிட்டு உங்களுக்கு புரிய வைக்கிறதுக்காக ஒவ்வொரு விஷயத்தையும் உங்களுக்கு எக்ஸ்பிளைன் பண்ணிட்டு இருக்கோம், இன்க்ளூடிங் கோல்டன் பாயிண்ட்ஸ். ஸோ ஒரு கொஸ்டின்ல வரக்கூடிய ஆப்ஷன்ஸ் மட்டும் எக்ஸ்பிளைன் பண்ணாம மற்ற கோல்டன் பாயிண்ட்ஸும் வைட்டல் பாயிண்ட்ஸுமே உங்களுக்கு வந்து எக்ஸ்பிளைன் பண்ணிட்டு இருக்கோம். ஸோ ரெகுலரா இந்த சேனலை வந்து பார்த்துக்கிட்டே இருங்க. சப்ஸ்கிரைப் பண்ணாம நிறைய பேர் பார்த்துட்டு இருக்கீங்க, சப்ஸ்கிரைப் பண்ணிட்டு பாருங்க. அப்பதான் நாங்க போடுற வீடியோ, நாங்க போடுற எஃபெக்ட் உங்களை வந்து ரீச் ஆகும். உங்களோட சக்சஸ்ஃபுல் ஜேர்னிக்கு இது ஒரு பாத்வேவா அமையும். ஸோ எவ்ரிடே மார்னிங் நீங்க இந்த மேஜிக் பில் செஷனை கண்டிப்பா அட்டென்ட் பண்ணுங்க. கண்டிப்பா இது உங்களுக்கு எக்ஸாமுக்கு ரொம்பவே ஹெல்ப்ஃபுல்லா இருக்கும். வாங்க வீடியோக்குள்ள போகலாம். So let's start with the first question. Today we are going to discuss OG. So the first question is, the classical method used in bringing down an arm in breech presentation is called as. So in a single reading, you're supposed to know the key points. So keep on, I'm saying that because these way of reading and understanding the question will make you to reduce the amount of time you are consuming in reading the questions. So in a single reading, you have to understand what is the question is. Okay. So here the classical method used in bringing down an arm in breech presentation is. Here the keyword is arm in breech presentation and what classical method is used here. And they have given 4 options like Metier, Smelly weight maneuver, Lauset maneuver, Burn Marshall method, and Pinard maneuver. Among these, the right answer is option B, that is Lauset maneuver. So why I have selected this Lauset maneuver? The rationale behind this is the Lauset maneuver is the rotation of the trunk of the fetus 180 degree during breech, but to facilitate the delivery of extended arms and shoulder. Let me explain everything with the images so that it will be easy for you to understand. See, in Lauset maneuver, the first thing what you're supposed to understand is in your extended arms and shoulder in case of breech presentation. This is the keyword. Okay. So in case of breech presentation, if the fetus is having extended arms or shoulder, that time we are using what? Lauset maneuver. So here we are rotating the trunk of the fetus to 180 degrees. So this is the 2 key points, golden points you're supposed to remember in the Lauset maneuver. Here you can see in this image. So the first image is Lauset maneuver. Here you can see the fetus. See, they are rotating. Here you can see the extended arms and shoulder. Okay. So in the second image, that is B, A, B, C. So 3 images are there. In the B image, you can see very clearly the extended arms. Okay. So here, because of the extended arms, you are using the Lauset maneuver method. So here, what is the classical point we supposed to remember is we are turning or rotating the fetus trunk into 180 degree. That is very, very important. Okay. So after that, we are delivering the baby. So turning 180 degree because of the extended arms or shoulder. So that is called as what? Lauset maneuver. So the next option is, so that is the right answer here. The next options image, it is clearly mentioned here. The baby is having what? Extended legs. You can see here, consider this as a left leg. It is extended, right? So here, in case of extended leg is present for the fetus, immediately we have to go for what? Pinard maneuver. So in Pinard maneuver, the vital point what you're supposed to remember is extended leg. In Lauset maneuver, which golden point you're supposed to remember is extended arms. So extended leg means Pinard maneuver, extended arms means Lauset maneuver. So how here in Pinard maneuver, where they are applying the pressure and how they are delivering the baby, here the pressure is applied in the popliteal fossa. You can see here the pressure is applied in the popliteal fossa. So where is the popliteal fossa? It is just behind the knees. Okay, just backside of the knees is called as what? Popliteal fossa. There the physician is applying the pressure to flex the knees. So once the knees are flexed, it will be easy for the baby to deliver outside. Okay. And other options like Manicure Smiley weight maneuver. Here the malar flexion and shoulder traction is applied for delivering the baby. So what is this? Again, let's go with the image, because image is very, very important. Image based questions are very, very common nowadays. So you have to go with the images. Okay. So here you can see very clearly. So one person, they are giving the suprapubic pressure being applied by the assistant. So one person is applying the pressure in the suprapubic region. This is the one. And the second physician, one finger is, the physician is holding the malar. Malar in the sense what? Jaw. Here you can see very clearly. Malar means what? Jaw. The physician is holding the jaw. At the same time, the physician is doing the flexion of the shoulder and traction method she is using and delivering the baby. So two things is happening simultaneously. The first thing is one person is giving pressure over the suprapubic region, and another person, she is delivering the baby by keeping one hand over the malar. Malar in the sense jaw. Okay. And another hand over the shoulder, and she is giving a flexion and traction method in order to deliver the baby. Okay. So this is called as what? Metier weight maneuver. And the next one is Burns-Marshall method. So what is this method? First, let's see about the definition. Burns-Marshall method means it is the method used for delivering of after coming head. Mainly here, the complicated structure is there, means the head, it will be difficult for delivery. So in that situation, we are using the Burns-Marshall method for delivering the head of the baby. So here you can see in the image, it is clearly explained. So Burns-Marshall maneuver, here what is happening, you know, first, this is A, this is B, C, D. So 4 steps are there here. So the first one is hanging the baby. Okay. And because of the weight of the baby, the head is present inside the mother's womb, whereas body is present outside. So the baby is hanging like this. And because of the pressure, the baby backside hair is visible. You can see very clearly here, the hair is visible, right? So once the hair is visible, the next step is this one. Hold his feet, hold the baby's feet and free his mouth and suck him out. So here you can freeing the mouth. So first we are hanging the baby. Second, we are holding the feet. Third, we are lifting the baby. So the mouth is coming outside. Okay, the chin and mouth part is coming outside. And followed by that, what is happening? The baby head is also wiping out and the baby is delivered out. So this is called as what? Burns-Marshall maneuver. Okay, guys. So for this question, which is the right answer? The right answer is Norcet maneuver. Why? Because here they mentioned bringing down the arm in breaching presentation. So arm is present means immediately we have to go for what? Norcet maneuver. The second question is, when a client experiences the urge to push at 9 centimeter dilatation. So the first keyword what you're supposed to note here is the client is experiencing the urge to push at 9 centimeter dilatation. Okay, so that is the first key point, 9 centimeter dilatation. The breathing pattern that the nurse should instruct to the client to use is that. So the mother is in labor. Okay, so this time, what type of breathing pattern as a nurse we supposed to instruct? So that is the question, guys. So 4 options they have given here: expulsion pattern, slow chest pattern, pattern or blowing pattern, accelerated or disrelated pattern. So 4 options are given here. Among this, the right one is option C, that is pattern or blowing pattern. You can see the image here. It is the way the mother has to blow during the expulsion of the fetus. Let's see in detail. See, the breathing technique used during the first stage of labor. See, these are all the breathing technique which is used during the first stage of labor. So what are all the breathing technique used during the first stage of labor? Slow, modified and pattern breathing. So 3 types of breathing they are using in the first stage of labor. All these type of breathing, you know, collectively called as paced breathing. What is that? Paced breathing. Here you can see here. See, all the question, whatever we are discussing, you know, it is taken from previous year question papers only. Okay. So as I mentioned already, in the first stage, we are using paced breathing exercise. 3 types of paced breathing exercise are there. What are they? The first one is slow paced breathing. Second one is modified paced breathing. Third one is pattern paced breathing. See, in this graph, it is very clearly you can understand what is slow, modified, and pattern breathing method. So slow paced breathing means, you can see here the relaxing breathing will be present. The relaxing breathing is also called as cleansing breathing. What is that? Cleansing breathing or relaxing breathing. Okay. So a relaxing breathing is present, followed by that a normal pattern of breathing. So inspiration, expiration, like that. A normal pattern of breathing is there. That is slow breathing is there. Followed by that again, once again, relaxed breathing. Relaxed breathing means what? A deep breathing. Okay, so one relaxed breathing, another relaxed breathing. In between the two breathing, what we have to instruct, slow breathing has to be there. A relaxed breathing is present in the initial stage, followed by that slow breathing, again a relaxed breathing. So this type of pattern is there, means that is called as what? Slow paced breathing. In the starting of the stage, that is first stage of labor, we have to start with this slow paced breathing, followed by that modified paced breathing. It is also same like slow paced breathing, but here the count of respiration is increased. In slow paced breathing, just consider 18 breaths are there for the mother. Whereas here in modified paced breathing, around 20 to 25 breathing will be present in between two relaxed breathing. So here one relaxed breathing is present, here one relaxed breathing is present. In between two relaxed breathing, at least 20 to 25 breathing has to be there. In slow breathing, 15 to 18, whereas here 20 to 25 breathing. As it is just an example I'm giving. I'm comparing the slow paced breathing and modified paced breathing. Okay. The next one is pattern paced breathing. What is that? Pattern paced breathing. So here, what is happening? It is the end stage of first stage of labor. In the end of the first stage of labor, we are using the pattern paced breathing. So here, what is happening here? Here also two relaxed breathing is present. But in between two relaxed breathing, three inspiration, slow inspiration, three inspiration and one blow like this. I have shown the image also. Again, three slow inspiration and one blow. Three inspiration. See, not only inspiration, three inspiration, expiration and one blow. Blow means heavy blow. Three inspiration, expiration and heavy blow. Three inspiration, expiration, heavy blow. So like that, pattern has to be maintained. Okay, so this is called as what? Pattern breathing. Slow, modified, pattern. Slow means a small or a regular respiration, but it has to be very slow. Modified means the regular respiration, the count has to be increased. Pattern means three respiration followed by that a blow. Okay, and again three respiration followed by the blow. Okay, fine. So during contraction, the blow has to be there. Contraction of the abdomen, so that time the blow has to be there. Okay, whatever I have explained now, it is given here, just to go through it. Okay, the next question is, which of the following is not the component of the Bishop score? Four options they have given here: cervical consistency, cervical dilatation, position of head and station of head. It is a direct question. In this kind of direct question, no need to search for any key points. So directly they have asked which of the following is not the component of the Bishop score. So among this, the right answer is option C, that is position of head. So why we selected this option? See, Bishop score, first you should know what is Bishop score. It is a system used to evaluate the maternal readiness for the successful elective induction of labor. Whether the mother is ready for the elective induction of labor, how you are measuring? By means of using a score called as Bishop score. Okay, there is a spelling mistake in Bishop score, just correct it. So in Bishop score, 5 indicators are used in the Bishop score. What are all they? The first one is cervical dilatation. It is usually measured in centimeter, as you all know. Second one is cervical position. Third one is effacement. It is usually measured in percentage. All these points are very, very vital points, guys. Okay, and next one is head station. Third one, last one is cervical consistency. So these are all the 5 indicators which is present in the Bishop score. What are all they? Cervical dilatation, cervical position, effacement, head station, and cervical consistency. So each factor has a score of 0, 1, 2, 3. So minimum score is 0 and maximum score is 3. They have given here. And the total score is 13. What is the total score? 13. All these points, one by one, everything is the golden points. Okay. And the favorable score is 6 to 13 and unfavorable score is 0 to 5. Okay, favorable score is 6 to 13. It means that the mother is ready for what? Induction of labor. Unfavorable score means 0 to 5. The mother is not up to the mark for the labor. Okay, guys. So let me show the image also. This question asked in AIIMS nursing officer exam. So this is the Bishop scoring system. You can see the score very well. It is mentioned here 0, 2, 3 as I mentioned already. And the last 5 points are dilatation, position of cervix, effacement, station, and cervical consistency. See, all these points are mentioned in the Bishop score. Okay, so as I mentioned already, all these 5 points are golden points. Please make sure you understand the concept. Okay. The next question is, partogram includes all salient features of labor except. So 4 options are given here: pulse, fetal presentation, fetal heart rate, frequency of contraction. Among these, the right answer is option B, that is fetal presentation. So what is the rationale behind this? You should know what is partogram. See, partogram is also called as what? Cervicograph. In the exams, even they can ask us a cervicograph instead of partogram. So make sure that whatever the word, keyword is present in the question, you should know what is the answer. So partogram and cervicograph both are same. Okay. So component of partogram or cervicograph of a patient, which includes identification data, time, fetal heart rate, state of membranes, color of liquid, cervical dilatation, descent of the head, uterine contraction, fluid and drug used, recording of BP, pulse, temperature, urine analysis. See how many components are present in the partogram. I will be showing the image also because image-based questions are very common nowadays, right? So apart from these features, the alert line and action line, 2 line is also present. So what is alert line and what is action line? Alert line indicates the cervical dilatation during the active labor. It is mentioned here. And action line indicates the progress of labor, whether it is going normally or abnormally, and what action or what intervention you have taken, and within how many hours you have taken. Each and everything will be there in the action line. Understand, guys? Fine. So let me show the image so that it will be easy for you to understand. So these are all the components of the partogram. So this is how the partogram looks like. Okay, so it contains what? So mother's information, that is basic personal details, it will be there here. Followed by that, fetal well-being. It includes fetal heart rate, characteristic of liquor, that is the fluid, and molding, labor progress, that is dilatation, design, uterine contraction, medication, what medication you have administered, oxytocin or any other pethidine like that, and maternal well-being. Okay, so fetal well-being, maternal well-being, medication, labor progress, each and every components will be present in the partogram. Apart from that, as I mentioned already, alert line and action line. So these 2 lines will be present. Okay, guys. So all together, it is called as what? Partogram. The next question is, vaginal examination and amniotomy during labor causes rise in maternal plasma oxytocin level, known as. So here in this question, the keyword is raised maternal plasma oxytocin level during vaginal examination and amniotomy is known as. Understand, guys? Fine. So let's see the options. Braxton Hicks contraction. So definitely it is not there. Braxton Hicks contraction means, as you all know, that it is a false contraction. Okay. It is an irregular false contraction. Lightning, that is descending of the fetus. And Ferguson reflex, we will be discussing that. And show means that is the dissolving of the mucus plug which is present in the cervix, right? Fine. So on these 4 options, the right answer is option C, that is Ferguson reflex. So what is Ferguson reflex? It is also called as fetal ejection reflex. It is a neuroendocrine reflex initiated by the pressure at the cervix. Okay. See, during pressure, if you are creating in the cervix, whenever you are creating the pressure in the cervix, that time this Ferguson reflex is activated. So what is that? It is nothing but the oxytocin level is increased. Once again, let me repeat. Ferguson reflex means whenever the cervix is stimulated, for example, during amniotomy or during vaginal examination, so the cervix is stimulated means immediately the neuroendocrine reflex is activated, and what release is taking place? The hormone oxytocin is released. So on the whole, this is called as what? Ferguson reflex. Okay. Fine. This question also asked in AIIMS exams. Okay. So here you can see, as I mentioned already, so whatever the options which is mentioned in the question, we'll be discussing each and everything, right? So already I have given the brief explanation. Here you can see the difference between Braxton Hicks contraction and labor, normal labor contraction, because Braxton Hicks, it's one of the option in that question. See, Braxton Hicks contraction, you can just go through it. It do not come regularly. Okay, and contraction may stop when walking or changing in the position. Okay, whatever you are doing, immediately the contraction will stop because it is a false contraction. Okay, there is no regular contractions. Okay, it is an irregular contraction. Okay, it will not be so much stronger. It is a weak contraction, usually felt in the front, that is in the front part of the abdomen. Whereas in the labor contraction, it lasts for 30 to 70 seconds. Okay, the contraction continue despite whether you are moving, changing the position, doesn't matter. The contraction will continue. Okay, and it's steadily stronger. Gradually, it will become stronger. And usually the pain will be felt in the backside, not in the front, like Braxton Hicks contraction. So lightning, as I mentioned already, descending of the presenting part of the fetus in the pelvic inlet. Okay, so that is called as what? Lightning. And show, it is also called as bloody show. See, the mucus plug which is closed or present over the cervical region, it is going to dissolve and it is going to come out. Okay, so that is called as what? Show. It is an early sign of labor. Okay, guys. So thank you very much for watching this video. So far, we discussed about OG questions. We discussed the key points, golden points, and extra whatever the point which is related to the question, each and everything we explained. So the thing what you're supposed to do is watch again and again, subscribe to the channel so that every day the questions, whatever we are posting, it will reach you. So whenever you're getting the leisure time, you can go through it. And thank you very much for watching the video, and all the best for your upcoming examination, guys.